Thank you so much. So before you start, Dr. Harris, I'll go ahead and give a little bit of a background about you. So what everyone has been waiting for, Dr. Mercedes Harris, she has a doctorate in pharmacy as well as a master's in public health. She's a public health pharmacist consultant. She has over 2 decades of service within community pharmacy and public health. She's a native New Yorker from Queens, and she's dedicated to creating those culturally sensitive programs to her ancestral ties with the Caribbean community as well as internationally. Dr. Harris has spearheaded a teaching kitchen organization with a focus on community promotion, monitoring, and literacy strategies for both youth and adult populations. Dr. Harris has authored several publications highlighting those approaches to improve the health of minority, underserved populations, and a particular focus on lifestyle-related and non-communicable diseases. She's received her doctorate in public health degrees from St. John's University and the University of West Florida. Amongst her other accomplishments in 2022, she was awarded the Next Generation Pharmacist Award that salutes pharmacy professionals who are defining the future of pharmacy by pharmacy industry leading companies, Parata Systems, and Pharmacy Times, and under the category Patient Care Provider of the Year. So we wanted to give a warm welcome to Dr. Mercedes Harris, because not only she won the 40 Under 40 Public Health Award, but she's also won the Health Innovator Award with the Boston Congress of Public Health. Mercedes, feel free to take it away.
Thank you, everyone, and thank you, Dr. Carpenter, for such a beautiful introduction. Yes, so welcome everyone. My name is Mercedes. I'm a pharmacist, but backgrounds originally from US, New York, as she mentioned, Queens, and I relocated August 2022 to my ancestral ties within the Caribbean, but specifically Barbados. So just the background of how I got to Barbados is in 2016, I was in the pharmacy and I was counting out a Flagyl prescription. And ever since I was in pharmacy school, they always spoke about non-pharmacological treatments, lifestyle modifications, speaking to the patient, and then if necessary, then pharmacological treatment. So I always wanted to be the type of pharmacist that spoke with the patients and consulted. And when I first started out, I guess my trait of being around my grandmother all the time, speaking, she could talk to someone for hours and hours and hours. Growing up in New York, I remember being in Woolworth with her as a kid, and she could talk to someone for 3 hours. So I guess that helped coming into pharmacy, speaking to the patients, especially speaking about a lot of sensitive topics and getting them to open up and to be comfortable. So I guess that trait rolled over into pharmacy. So as a background, I was in the pharmacy and I was like, I want to go, I can't do this. It was 2016. I graduated in 2008. And I'm like, I want to be of service more than outside of the counter, not just behind the counter. So I called my mom and I was like, listen, I'm taking a year off unpaid. That's how I wanted to just get outside of the pharmacy on the other side of the counter. And I was like, she's like, where are you going? And I'm like, I don't know. I'll just go back to where I used to go as a kid and I'll go to Barbados. So to be of service there. So that's how it all started. So in 2016, my first job working in community pharmacy, I opened up the phone book. Now in this day and age, it's like I'm dating myself. But I opened up the phone book and I called every single pharmacy and I asked, are you hiring? And one of them in Brooklyn was hiring and I started that way. So in 2016, again, I'm an older millennial. I was like, if it worked back then, let me see if it'll work this time. So in 2016, I just wrote a letter to whom this may concern. I just wanted to volunteer and I just reached out to all the areas that would utilize a pharmacist. So one of the nonprofit organizations that focus on diabetes said, okay, so coming from dispensing in the pharmacy to now outside of the pharmacy and now in now more public health, I was like, I don't know what to do. So I'm like, let me see what I could do to target the youth population, because in the Caribbean or everywhere, especially, there's a growing incidence of diabetes. So I wanted to focus on innovative ways to help attract the youth population. So I was like, you know what, I'll just volunteer and work on your social media. So they had Facebook at the time. So at baseline, it was like 300 participants viewing their social media page. So the goal, I wanted it to be timely, accurate information that would attract the audience. So I was looking up different news articles, and one of them focused on the teaching kitchen concept. So I was like, all right, I'll focus on that. So that's where the whole teaching kitchen concept came. And then digging in further, I found out that the Culinary Institute and Harvard School of Public Health had the Healthy Kitchens, Healthy Lives conference. So I was like, you know what? If you don't invest in yourself, no one's going to do it for you. So I was like, you know what? Taking a year off, I'm like, let me just focus into that. And again, depending the type of pharmacist or the type of person you are, a lot of people, or some people, have a sense of fear, or especially being in pharmacy, you don't want to take risks because of the complications taking risks. You may give out the wrong drug, an error may occur. So sometimes pharmacists or people as a whole are risk averse. So I was like, you know what, I got to invest in myself, because if not, no one's going to do it for me. So I again, dating myself. So I was speaking to a younger person about the Looney Tunes cartoon, and I was talking about Wile E. Coyote and the Roadrunner, and what I felt, how it felt. The only analogy I could come up with is when Wile E. Coyote ran off the cliff and there was no safety net. So it was scary, but I was like, I have to do it. So I went to the conference in California in Napa Valley, and it was just so transformative because, again, growing up in Queens, one of the most diverse areas in the country, you're exposed to so many different cultures. And even my friends from elementary school, I still speak to them to this day. One is Filipino, one is from Croatia, one is from Chile. So just being immersed in the different cultures, and you realize that how you grew up or your experiences that you have roll into who you are as a person, as an adult until now. So again, to go back, what I have is it's a teaching kitchen concept. So basically including the concepts of health education and culinary nutrition together to try to find innovative ways to improve health outcomes. And that's the focal point of that conference, is finding innovative ways to help improve health outcomes. Because when you speak to the patients or people as a whole, if it doesn't taste good, you're not going to get the outcome that you want, and people aren't going to eat it. So if it doesn't look presentable or if it doesn't taste good, you're not going to get the outcome that you desire. And that conference really molded in the blend of those two disciplines, to which I'm grateful for. So, yeah. So in the next slide, it's just an offering of the services that we provide. So we do in-person, online, we do health culinary institute, so where it's like a teaching school, personalized wellness consults, so focusing on the health care side of myself, custom meal prep, private events, the CDC diabetes prevention program, and then corporate and wellness events. So my main goal is to remove as many barriers as possible. So there's no reason why, oh, I can't get to you. We're mobile too. So we go to where you are. So on the next slide, it says, so what exactly is a teaching kitchen? So the Teaching Kitchen Collaborative just has an explanation of what a teaching kitchen is. And it's described as a virtual learning laboratory for life skills, especially, in this day and age where you have all these apps, you could just, within 3 clicks, you could have food sent to your doorstep. But especially with the youth and the adult population, but focus specifically on the youth population, showing the youth innovative ways, life skills too, because so that they're making conscious, educated life decisions, especially with chronic disease and the rising rates of chronic disease. So on the next slide, I focused on, again, we're mobile. So I have all the equipment, everything that you need. All I need is electric outlet. And again, at the Healthy Kitchens, Healthy Lives conference, they're like, not everyone is going to have you could go to the next slide, please. With the teaching kitchen concept, not everyone is going to have a full designer kitchen. So they focused on you may be dealing with participants that have the space of like a like a bar refrigerator, like the refrigerators that you see in a hotel room. And the top of that surface area is a space. So being conscious and mindful of that as well. I'm on slide 5, the next slide. Okay, yeah. So
Sorry
again, a
about that.
modular, no, that's fine. So basically a modular pop-up kitchen, a temporary kitchen. Again, I have all the tools to remove as many barriers. All I need is electric outlet. And then it's open to all participants 5 years and older, because again, I don't want to exclude everyone. I want everyone welcome. So again, focusing on health education, NCD prevention and monitoring, and including like a STEM lesson incorporation. Growing up, I could understand now because my daughter is 6. I didn't have to go to summer school, but my mom would put me in summer school. So now, as a parent, I totally appreciate and I totally understand. So basically, I wanted to incorporate that STEM lesson incorporation, because another reference is I equated it to Miss Frizzle and the Magic School Bus. I wanted to incorporate science, math, education, nutrition, even Bill Nye the Science Guy. So that's basically a hallmark of our programs. We focus on youth, young adult, and then elderly as well. Okay. I'll go to the next slide regarding the chronic disease. Yeah. So again, as we are familiar with chronic disease and its effects on communities, heart disease, the #1 cause of death of both men and women in the United States and mostly in the world, obesity, cancer, and diabetes. So I'll elaborate further, but chronic disease, depending if that person is a breadwinner of a household, if now that person has heart disease, is afflicted with cancer and now diabetes, that affects the income of that household. That affects the structure of that household. That affects the labor output of, if that person has to pull out sick, they need to go to a doctor's appointment. Now, if their diabetes is not controlled, they have an amputation. Now that they're not able to work. So now there's a loss of an employee at a particular job, a loss of income at home. It affects a country's productivity as a whole. So how chronic disease affects, it's not just that individual, but communities, families, and a country as a whole. So yeah, that's my main goal. And then with the next slide, the whole culinary nutrition and the goal of improving health. So balance healthy foods to help with disease prevention, treatment, and cure. So a hallmark of our class is, again, my main thing is reducing barriers. I don't want people saying, yes, healthy food can be expensive, right? But depending how you use the different products. So I always try to target the meal to the price of a value meal so that people could say, all right, there's no reason for me not to choose this healthy food, because I could eat the cost of a value meal for a healthy food alternative. So a hallmark of our program is we try to feed us at least a family of 4 for the cost of a value meal, because say now with the increasing costs, say a value meal maybe, or a meal for a family is close to $20+. So with our meals, we try to keep it low cost so that it could feed a family of 4, rather than spending, say, $12, $15 on one person. You're spending that, but it's at least it could stretch to like 4 people at most. So that's another component of our program. And then the next slide just talks about the benefits of a wellness and cooking program. So again, we have the CDC National Diabetes Prevention Program. So we do 6-month and 12-month programs. And again, mindful behavioral change, lifestyle modifications, and then is it behavioral modification? Again, motivational interviewing. That's another component that we do in the class. So the next slide is cooking as a group. Participants learn the various health topics. Again, we're all learning from one another. Even though I have these degrees, that doesn't mean I know everything. So I love learning from one another. And it just reduces the pressure, again, so that when someone else hears, and the power of a testimony, how important a testimony is, because I've been through some challenges and I realized, oh, I'm not the only person going through it, and especially with mental health. So that's why this program is so fun. It's not just we're learning about health education, we're cooking and we're eating, but it helps with mental health too. You're around others, you're in a community setting, a safe setting as well. So the next slide just discusses the previous events in the community. So coming from New York, Queens, the city area, I relocated to Florida, Central Florida. So most of the programs that I did was in the Orlando, Central Florida area. So I did certain health fairs. Whenever there was a health fair, I'm like, are you available? We're available. We can come out. Just again, it was just me, so I had to market myself. So I just reached out to anyone that would listen and give me an opportunity. So churches, community centers, the health department. So those are just some of the pictures that I've done in the past when we first started out. And then the next slide is we would focus our programs on different health awareness months. So say March is colon cancer awareness month, or November is diabetes awareness. So our classes for that month when we did a health fair, so say for March, we focused on colon cancer awareness. What is colon cancer? Ways to improve your incidence of not acquiring colon cancer, foods that you can eat, foods that are helpful, foods to abstain or eat less of, and foods to eat more of. Right? And then again, to show the public the different facets of a pharmacist. Yes, a pharmacist is in the community setting, the pharmacies that you know. Yes, we're in hospital. Yes, we work for drug companies, but we do so much more than just those three things, and just to show and elevate the profile of a pharmacist. So the next slide, the breast cancer awareness, that was very touching, and that was the reason why I started this whole program. Because my mother, when I was in pharmacy school, in my last year of pharmacy school, 2008, just learning the cancer medication, I found out she was diagnosed with breast cancer. So she was diagnosed at 45, and I'm just learning the cancer medication too. So in 2008, she had a mastectomy. I'll go to the next page. My mom was a hairdresser. That's her in the 80s on the left. So Janet Callender, and then later on in the story on the right, Iris Callender, my grandmother. She was 88 at the time with my wig on, but she was 88, Iris Callender. But basically, my mom was diagnosed with breast cancer. She was a hairdresser working for 30 years. And probably, who knows, maybe her environment, her occupation contributed to her breast cancer, but she had breast cancer. So she had a mastectomy, chemo, and that was the treatment for the past 10 years. In 2016, I was like, you know what? I'm taking a year off. I'm going to Barbados. So I was interning to be a pharmacist in Barbados. It took forever to get that internship. And a month into the internship, I found out that my mom's breast cancer went to her brain and spine, and that she had 4 months to live. So she was diagnosed with leptomeningeal. So I'm like, I cannot believe this is happening. This is like what I see in the movies, and it's happening to me. So finding out my mom had 4 months to live, finding out I was pregnant with my first child, her first grandchild. Oh my God, this is something else. Because when I left the pharmacy and took that year off, I was like, I want to be of service, but I didn't expect it to be like this, right? So being a pharmacist, working in the pharmacy, even as a student from 2002 and now to 2016, 2017, and now dealing with so many patients, dealing with so many medications, patients that have been in the hospice setting and whatnot, and now my own mom, you could throw as much medication as you want, but when it's that person's time to go, that's it. So the next page just has certain snapshots of a kid. My mom, when I was like, I guess 6 years old, to the right as a child. I remember every time after church, we would go to the Marriott for brunch. So my favorite thing was like waffles and stuff like that. So every time after church, we would go for brunch. And then that's just me when I graduated pharmacy school with my grandmother. So they were instrumental in my life. They were like my mom and dad. Yeah. Yeah, you could go to the next slide. So my mom, so I left, that was November 2017. I went back to Florida, dealing with hospice, and now me being now a caregiver, being a pharmacist, dealing with so many patients in hospice. Now I'm the caregiver, taking care of my mom, and at the time my grandmother. And I give it to, not, it made me more empathetic as a pharmacist. So even though this was a sad experience, it helped me learn and grow. And then in these peaks and valleys, sometimes you always want to be at the peak, but that's not necessarily the case. You learn and you could see it puts you through the ringer, these valleys, but you really learn what you're really capable of. So basically, my mom passed January 2018, 4 months pregnant, and I didn't even know they had in-home hospice nurses that come to the house. So in my mom's last days, my mom wanted to stay at home, so she came to our house. One of the rooms were free, so she was there. And in the middle of the night, I would just wake up just to see if she was breathing. And the nurse was like, "That's why I'm here. You don't have to do this." So it's just, that was something else. So basically, my grandmother, because that was my grandmother's only daughter, she had 5 children, 4 boys, 1 girl. It was to a point when she was in the hospice, they didn't even know who the patient was because my grandmother was always with my mom. So then January 29, 2018, my mom passed. And then a week after my mom passed, my uncle was like, "You know what? You're getting more and more, you know, developing in your pregnancy. Let me take over care." So I was getting her ready for the airport, my grandmother. And she's like, "I'm dizzy, I'm dizzy." And she just dropped to the ground in front of me and she had a stroke. So thank goodness for the CPR training and whatnot. I just put it to the side, on her side, called 911. And basically, my grandmother passed from a stroke. So I lost my mom and my grandmother, cancer from my mom and stroke complications with my grandmother, and pregnant, So I was like, you know what? I want to go back to Barbados because growing up as a kid, we would go every year from New York, JFK, and just, anyone, depending on the type of traveler you are, just the excitement of getting your luggage, what you're gonna wear for the airport and this and that. And I was like, you know what? Barbados made me the happiest. So I was like, I want to go back to Barbados. Then COVID came and that delayed everything. But I was like, you know what? I want to go back to Barbados. So basically, I cold called again. The, just the patterns that I would do from like my first job in the pharmacy. I cold called the embassy of Barbados and I'm like, "I have ancestry here. I just want to give back in any way possible." And they're like, "Yes, all right, come down to DC. We'll love to have you." So they had a round the world embassy tour and we just did a healthy kitchen education focusing on the meals of Barbados to participants in the DC area. So the next slide is basically what I do now. So I'm in Barbados presently. I moved August 2022. I shipped a 40-foot container down. I just left it to the Lord and I was like, listen, being a pharmacist, in my mind, I was like, if someone asked me before 5 years from now what you have planned, I'm like, I'm gonna do this, this, and this, and this. But dealing with my mom and my grandmother's situation, you could plan as much as you want, but when something happens, that's it. You just have to adapt. So I was in church one day and they were talking about the 5 loaves, 2 fish story. And again, I love food. And I was like, they were talking about, you know, the meaning of that story. So for me, it's everyone has different talents and gifts to give to the world. And it's not just for us to keep amongst ourselves, it's to us to spread to others. So again, I developed the whole logo when I was in church, the whole plate, the fork and knife, 5 loaves, 2 fish. I just developed everything. So transitioning from pharmacy to public health, marketing, and all this other stuff, just trusting and believing in yourself. So I shipped a 40-foot container, my car and everything. I was like, I'll just leave it to God. Whatever happens, happens. So basically, in Barbados, they had different medical clinics through the government. So I reached out to them and I said, would you be open to us doing health education programs in your waiting area? So again, I have all the tools. All I need is electric outlet. So when they do the setup, it's like an ambush. So people are waiting in the waiting room and they're like doing a cooking segment. They couldn't believe it. So that's basically what we would do. So again, it's an island, it's a small island developing state, so they rely on a lot of imports. So informing and instructing patients, participants, how to read a nutrition label, how many grams or milligrams of sodium or how you should have in a day. So that's just the summary of what we would do in these programs. Going out to the primary schools or elementary schools, showing the kids ways of juicing and making smoothies with minimal ingredients. You don't need a Vitamix blender. If you have just a strainer at home, you can make a juice or you could make a smoothie and stuff like that. Just small, achievable methods, utilizing the local crops, fruits and vegetables, foods, healthy, unprocessed foods. That's what we focus on, unprocessed foods, whole foods that you can make at home. Not everyone has 2 hours to make a meal. So meals that could be made within a half an hour and an hour. Again, close to what you would spend at a value meal at one of the fast food restaurants. So that's just the main targets of our programs. So the next slide is just what we would do at the elementary school setting or in the school setting. So here in Barbados, they say primary and secondary school, which is primary is elementary school and secondary is like high school. So on the left in the green, that's my daughter's school. So she's now 6, but we did a program, they started at nursery or reception. So it's like, say, pre-K, kindergarten, and first grade, all the way up to, say, 5th grade is their primary school. So basically, for the younger students, we show them how to make healthy juices and smoothies. And then with the older kids, they want more. So we show them how to make healthy chicken nuggets and sweet potato fries. So they participated in the meal preparation. And then with the healthy chicken nuggets, we had the panko breadcrumbing. So we had the chopped up chicken, and then we showed them how they could shred carrots and cabbage, and that acted as a coating for the chicken nuggets, and then show them how to make their sweet potato fries. And also incorporating, like, again, the STEM, so the math. So we showed them unit cost. So if you made this at home, you get 20 chicken nuggets more than what you would buy at a store for just 10 nuggets. So they like that component too. Oh, thank you, Lily. So in the second, on the picture on the right in the blue, this just happened this March. So basically it was just a month-long pilot program. So they call it class 2 students. So those are students that are ages 8 through 9. So again, the whole STEM program. So what we did was showing them how to make healthy waffles with buttermilk. So I showed them with heavy whipping cream, again, incorporating science. Whipping the heavy whipping cream, they got whipped topping. When you keep whipping it, you get buttermilk and the solids separate. So you get the butter and then the buttermilk. So we incorporated that, adding oats to make the waffles. So they see, all right, with heavy whipping cream, I can make whipped topping, I can make buttermilk, and I can make butter, and they made their own meal from that. So again, having it hands-on, because again, everyone learns differently. Sometimes I could say read chapter 3 through 5, but someone's not gonna, essentially now everything is pictures and videos. And especially now with the youth population, even as an adult, the attention spans are getting less and less. So basically having it hands-on. So that's the top left-hand picture, the child with the waffle. And then again, stemming back to when I was a kid in summer school, I was like, you know, let me test, even with the public health, let me test to see their literacy, retention, their knowledge, information. So basically, each week is going to, with like a short quiz on what was done last week, just to see if they're retaining the information and whatnot. And then assessments, again, public health assessments, monitoring, and whatnot. So on the top right-hand corner, you would see like a blue square, but basically it was healthy snacks. So each week was a certain thing. So healthy breakfast, healthy snacks, healthy dinner options. So on the top right-hand corner, they made healthy gummy bears. So they juiced a cucumber, a carrot, and an orange, and we made healthy gummy bears from that. So showing them that, oh, I don't necessarily need to eat candy. I could have a gummy bear that tastes like a gummy bear in the store, but it's healthy for me. So they made granola and they made healthy pasta. So showing them how to make pasta from scratch. So we incorporated spinach into the pasta. And again, the dexterity, showing them how to use a knife, showing them how to use a can opener, because some of the children, even in the States, didn't know how to hold a knife or, you know, a can opener properly. So just again, the life skills so that they're making educated decisions going forward. So the next slide, this is just a picture of what we've done. This is specifically in Orlando. So we did a healthy summer camp. So just showing them again, summer school orientation from my mother, and I was like, just make it fun for them. So I got them the paper chef hats. So all of that. And then the next slide is, I watch a lot of TV too. So all the cooking shows like Food Network and cooking channels. So again, I wanted to make it incorporated for them. So it was a 4-week program. And then at the end, they did a cooking competition based upon the skills that they learned over that time period. So the last week, it was a fun day, last day of camp. They made teriyaki chicken and plantain, rice and peas, and a pineapple boat. And again, I didn't want it to be, I'm an instructor. I wanted to learn from them. So I asked them up front, what are things that you would want to eat, learn how to cook? So the students were like, I want to learn how to make teriyaki chicken. I want to learn how to make plantain and rice and peas. So that's how that all came to be. So the next slide is just, again, pictures of what we've done in the past. So just as a way of saying thank you to the parents, we got them embroidered. They could choose between an apron or a chef hat with their name and the logo and a certificate of achievement, just to thank them. They love it. And I loved it too. It was so fun just being a kid again, not being so strict, being in pharmacies, you know, pronouncing these long names. I love public health, the aspect of health literacy. So I don't have to use all these complicated names like ACE inhibitors, the full name for ACE inhibitors. I could just be a kid again. So the next slide is just different public health outreach events that we've done in the past. So again, targeting different populations. So we do radio calls, Instagram lives with certain like-minded programs like Old Ways. This started out, again, volunteering at the diabetes nonprofit. So the bottom picture, doing that outreach and sending the information through their Facebook account. It went from 300 people to 30,000 people. So they're part of the International Diabetes Federation. So the president was like, why don't you create an abstract of what you've done? And that was it within 2 months, that leap in engagement. And I'm like, I never done anything like that. I was just in the pharmacy counting medications. So they accepted it in Abu Dhabi. So coming from Orlando, Florida to Abu Dhabi, I'm like, oh my goodness. And at the time, Emirates was flying nonstop. So that was 14 hours. So again, it's just a testament to believing in yourself, trusting in yourself. If you have a vision, that's, again, you know, don't let people confine you to a certain thing. You're capable of doing anything you put your mind to. It's hard because I'm in peaks and valleys, but just keep going. So going to Abu Dhabi and things that you would just see on Google Images, and now you're seeing firsthand. It's like, don't tell me such and such can't be done, because over there it could be done. So that's just a testament. So basically, that was in Abu Dhabi in 2017, and the top picture that was in Washington, D.C. Basically, the whole concept of the teaching kitchen, and then the picture on the right with me holding my abstract, that was in the Netherlands. So again, Google Images, seeing the pictures of Netherlands with the tulip fields, the windmills, and now I'm there presenting something that I love. And then the bottom picture is when I went to the Netherlands, I just like culture and travel. So basically, I left Orlando, and it was nonstop from Orlando to Dublin. So we went to Dublin, Ireland, and then we did the ferry to England, and then we did the Euro train to France, and then drove to the Netherlands. So that picture is Jon Snow. Public health people would be familiar with Jon Snow and the whole collar. And I'm like, I can't believe it. I'm seeing what I read about in the textbooks right in front of me. So that's that picture. So again, Dr. Carpenter alluded to, receiving the Next Generation Pharmacist Award in 2022, and just the other events that I would do in the community and other organizations. So the next slide is just the adult NCD program that I did in Orlando. So that was a 6-month program. Again, cold calling, reaching out to the community health departments if they're interested, and they're like, yeah. So that's how that started. So again, every month we focus on a specific disease awareness month. So, and just showing them innovative ways to improve their health outcomes. So at the program, at the beginning of the program, we did their weight, their blood pressure. We gave them documentation so that they have a personal record that they could track along the 6 months. Because with pharmacy, they would always say if it's not documented, it never existed. So basically, and then that gives encouragement too. So someone at baseline at, day one, if they see, all right, 10, a month later, they're losing 5 pounds, or now they're loosening up a notch on their belt. They're like, all right, this is working. So just to give encouragement to keep going, So that's just pictures of what I did over that time. The next picture is I would always ask open-ended questions. What are things that you're interested in? So one of the participants, he was diabetic he was in his 50s, but diabetic for the past 30 years. And again, the whole focus of being culturally sensitive. Even though I'm of African descent, I was born in New York. I'm in Florida. That's the South. So in November, I was like, we're going to do Thanksgiving. We're going to do pumpkin pie, this and that. And they're like, we don't do pumpkin pie. We do sweet potato pie. So realizing you have to be culturally sensitive too. So we made spaghetti squash. So that's what that picture on the right is. So again, and then learning too, because he was diabetic for 30 years. So he was just learning about his food choices was basically what his parents would make for him. So he loved pasta. So when we made the spaghetti squash for him, he's never tried it before. And it had all the quality traits of pasta, the twirlability, the density and whatnot. And he's like, I never have to eat pasta again, because that was his main thing. He's like, you could talk to me all you want about pasta, but I'm not putting it. So when he started eating the spaghetti squash, he's like, I never want to eat pasta again. If this is going to get me to my goal, I'm fine with that. So that was that. So again, we're always learning. It's not just because I graduated this and that. No, it's always continuing education, especially healthcare providers and professionals as a whole. And then the last picture is what we did. Again, we focus on different regions. So again, I love learning about different cultures. So again, the spice trade route. So that was Trinidadian chicken pilau. So when I was researching pilau before, and then we would always do a health education, culinary education component before, like say the first hour was that, and the next hour was cooking, tasting, and eating amongst ourselves. So learning more about pilau, realizing that it originated in Asia. So with the spice trade route, India, the Middle East, Africa and whatnot, the Caribbean, and then coming up to America. So that's what intrigued me most about it, because when you realize we're similar, we may prepare a particular dish differently, but the same components reign true. So that was that slide. The last slide that was in January. Everyone wants to do New Year's resolutions and whatnot. So we show them like different juices and just different ways of applying fruits and vegetables into their diet. And again, focusing on the culinary component, showing them the different dice cuts, because when you go to a fancy restaurant, just the type of dice or the type of cut makes the dish look so elevated. And again, with the Healthy Kitchens, Healthy Lives program, having the culinary chefs presenting it in a particular way, even their website, something as simple as a butternut soup, just the way it's presented, or they put the little swoop on the plate. It just elevates the meal. So we would do those different classes or exercises with the participants. So it was just a simple meal and we would say elevated. So that was what that picture was. And then the last slide is just a thank you for joining. And just that's my daughter. She was 1 at the time. And she's just my reasoning. God is something else. And without her, she's my motivation now, 6 years. She's 6 years old now, and just making sure that she has a healthy life, and making sure that myself as now a parent, making sure that I'm instilling, quality values, traits, education for her and for others, so that the reason why I do these programs is so that other families, if anything, my grandma would say, as long as there's breath in my body, to buffer the complications of chronic disease. Because this is now 5 years, and this year I was like, you know what? I'm tired of being sad, depressed, and upset, because my grandmother and my mother wouldn't want it for me. So I really appreciate the trials and tribulations. It made me stronger. And again, being here, having that mental concept now, I lost 50 pounds, because sometimes I would come down here every year. The first thing they'll say is, you put on size, not, oh, how was the flight? How was this? And stress, weight gain is not just I'm eating X, Y, and Z. It could be stress, hormones, this and that. So now that I'm in Barbados, I feel that they're close to me. These bangles that I have on now, this is when my grandmother was admitted into the hospital from the stroke. They took the bangles off of her. So these are 3 bangles. So I just say, they're my mom, me, and my grandmother. But the thing is, now being in Barbados, again, that long-term memory, being here as a kid and remembering all those memories, I'm in a better state mentally and physically. So I lost like 50 pounds. So it's not just I'm eating, it's stress too and other things. But thank you, everyone on this call. Thank you, Dr. Carpenter and Dr. Camante, for your time and just the recognition. And this just gives me motivation to keep going, because it's the motivation and just acknowledging and recognizing that you didn't have to, but you did. And I appreciate that. And then just the response from the participants, from the youth all the way up to adult, that's just my motivation. Because when we were doing those 6-month programs, the participants will go to their doctors or their healthcare providers, and their healthcare providers are like, what are you doing? You lost like 20, 40 pounds. We're reducing your medication. Instead of you taking it 3 times a day, you're taking it once a day. And they're like, what are you doing? And the participants were like, we're just going to a cooking class. So that's just my motivation to keep going and just be better for myself and for others. So thank you. Yeah.
So, Mercedes, Dr. Harris, thank you for sharing this incredible program today, and also the journey of doing and creating this program, because those of us in public health, and I think I can, probably a lot of people who are watching today, understand that this is not just a job. It's not just standing behind or handing out medications. This is a way of life. It's about improving the lives of those around you. It comes from a very personal space. And anyone who was watching could hear the emotion and the trials and tribulations you went through to get to where you are today. And thank you so much for sharing your story. So it's very moving and inspiring. There were some folks in the Q&A who had some questions in the chat. Do you have a moment to answer some of them?
Yeah.
So I guess the first one, very simple. How can people get in contact with you? I've shared the link for your organization. Is there a special anything else they should know, or?
Well, the website is 52 H as in house, Tom Kite. So 52htk.com. And that's the ad on all our socials. So Instagram, 52htk, LinkedIn, Instagram, Twitter, Facebook. It's been dormant, but I'm active. So I have everything connected. So you'll see what we've done previously. So now just getting back on the horse again and whatnot. But I'm available. Yeah.
Okay. Okay. And I guess another person asked, they were wondering if you had any resources for people in the States to run a teaching kitchen, because there's a lot of interest in here on replicating this intervention that you've put together and if implemented. Unfortunately, the person who wrote this question said, when I searched near me in OC, people would charge us $300 to $400 an hour for space to do a teaching kitchen, and that turned out to be way too expensive.
I
So
know it's true.
Yeah.
Yeah, depending on the population, for myself, yes, I could go to an affluent area, right? But those affluent areas, they're gonna have access to like 5 doctors on that one block, or dentists, or other allied health professionals. So for me specifically, I target minority, underserved communities, because those are the community or the populations that need outreach the most. But what Teaching Kitchen Collaborative and the Healthy Kitchens, Healthy Lives, those were instrumental, and that would just lead on to other targets. Yeah, the whole food is medicine thing is growing. You know, they have different academies and lifestyle medicine organizations. You know, Google, Google like Teaching Kitchen Collaborative, and then Healthy Kitchens, Healthy Lives, and then you'll see the other search results. Even like the Veterans Affairs, they're doing teaching kitchens. A lot of programs now are doing teaching kitchens. Yeah. Yeah, even, depending on the particular program with the CDC Diabetes Prevention Program, they may have a teaching kitchen component towards it. Certain health departments, they're adding it too. Yeah, because I started this in 2018. So it could expand even more so from when I first started in 2018.
Do you mind if I hop in there? I just wanted to I had because what you just said, Mercedes, I was thinking about that, how many other people are actually doing it. But to my question, as a physician and as some other physicians in the room who also are doing public health, how do you think this might be integrated into a hospital care setting? Is it something that's always going to have to be, where teaching kitchens are maybe off to the side, or do you think that we could actually bring this in, before patients are actually discharged?
I think, especially being a pharmacist, being the last link to all the things that happened in the past, they always talk about like pharmacy, they'll say FARMACY, or giving like food prescriptions, and speaking to the patient, we can't just do like blanket statements. Yes, we know we should eat healthy, but does a person have access to a healthy nutrition store, market? Do they have the disposable income to satisfy the goals? Yes, they want, depending on the patient, but some patients want to be healthy, but do they have the necessary means and resources to achieve those goals? So we have to be mindful of that. So that's why asking open-ended questions is so critical. I know things are timed and, the healthcare culture, what it is now, but as healthcare professionals to achieve because the thing is, I feel like sometimes we're on 2 different wavelengths. Like the healthcare providers, depending, their goal is the lab values. Are they in range for their cholesterol, their sugar, their blood pressure? But to John Smith, they want to be able to go to the park with their grandchildren and run about and play baseball. So our goals may be this and their goal may be that. So just trying to find a happy medium so we're equally fine, achieving the goals. But that's why with my program, I try to remove as many barriers as possible to get the outcomes that they would want and the outcomes that I would want. So I ask them up front, what is your goal for this program? So you have the assessment up front, you do a midpoint evaluation, and then your final assessment, you're able to see, all right, did you meet your target? Did they reach their target? So you're not wasting anyone's time, you're not wasting resources, and you're able to streamline for the future. But the thing is, a lot of school, like I'm in Central Florida, so UCF, University of Central Florida, they were exploring teaching kitchen programs, for their patients, and then to familiarize the healthcare staff with healthy meals. So when a patient, so they could have those conversations in the doctors, in the doctor's offices. But the thing is, at the end of the day, it's all about resources and funding too. I don't know. Funding is a major thing. Grants, yes, to keep it accessible, to expand. So that's the main thing. So hopefully, I don't know, the goals of these healthcare providers, they'll see the needs and the benefits so that they'll put the funding where it needs to be done. Because
Yeah,
it's good. People love food. They
I,
love
I
to have a good time. They love to party. So
I was just gonna say, Mercedes, I mean, that aligns with, what Dr. LeCompte and I had mentioned. So the fact that BCPH is giving out grants now. And so as part of memberships, we will be giving out grants ranging from $250 to $1,500, at least in the next year, and increasing. So people wanting to do teaching kitchens on this call, we're very interested, and we'd be very interested in funding those endeavors as well. So yeah, thank you so much for mentioning that.
thanks.
But I think we are at time. I know there are other questions. I think they can go ahead and send that to all the different ways that you mentioned that they can connect with you, Dr. Harris. But I just wanted to say thank you all for coming. This has been a great event. I know I learned a lot, and I love the movement for food as medicine. And it was very, a personal, inspirational story, Dr. Harris. And then I want to thank my team, Dr. LeCompte, for doing a wonderful tech job, and Sahir for helping to put all of the logistical aspects together as well. Thank you guys, and please be sure to join us next week and some upcoming weeks for additional webinars.
Thank you for the hearts, everyone. That's so nice. Thank you. All right. Bye-bye.
Thank you.